Tobacco treatment in the mental health field, and certainly at the Midtown Mental Health Center, is one of our primary focuses. About 80% of our population is addicted to nicotine.
In our time right now, we are charged with not just taking care of the mental health of a client, but also the physical health. And so our whole goal is to treat them as a whole person. And you can't do one without the other. And smoking and tobacco use really plays a huge part in that and really negates a lot of the potentials of what we can do to be effective in their care.
Yes, I'm also concerned that there is a certain hypocrisy in staff people smoking, but are really working, full-time on consumers not smoking. Certainly we're aware as more and more of us become smoke-free and we don't smell like smoke ourselves even when we're not smoking, that it's really, really hard for people who are trying to quit or who have recently quit to detect that little suggestion on the rest of us.
I know that if you just state it in general terms, like how could we ever, or we could never get our group homes or our staff to be smoke-free, if you think of it in big terms, that seems overwhelming. But if you think about it in smaller terms and you do it one thing at a time, it's a huge morale booster for staff when you say, we no longer expect you to go into a facility that is smoke-filled. And while there are still some smokers in our staff that might be okay with doing that, even they get it, that people that aren't smoking shouldn't have to be subjected to that.
I think when you have a mental illness, especially a serious mental illness, that's obviously where the focus has to be in terms of treatment. But what we're finding is that a lot of the people, as you suggest, that have a mental health disorder also have an addiction disorder, almost always including tobacco. It's really interesting as we look in Indiana at the opioid epidemic. One of the issues that might surprise some is that almost everybody that's addicted to an opioid is also addicted to tobacco. And the irony of all ironies is that the numbers in terms of death rate are much higher with tobacco.
I think it's really important as a leader in an organization to put the staff and their health in perspective. And what we said and what we believe in is that our staff should not have to go into facilities that are smoke infested.
We hear it a lot, that the change has to include us. To be honest, we get tired of hearing that. There's only so much that a small group of people can do. But there's an element of absolute truth to that.
I think hitting it with total support from senior leadership is critical. Everybody has to be on board because you will have complaints. You will have people that don't want to do it. I think that you have to hit staff and clients as well. You can't do one without the other. I don't think this is a choice that we have to make anymore about whether we do this or we don't do this. I think it's our obligation. We can't let our clients continue to die from tobacco-related diseases and illnesses, and we know they are. It's irresponsible on our part, so we have really not a choice about doing this. I think you have to grab it and go for it.